Hello everyone, welcome back to our channel. It's been a while since we spoke about anxiety and depression. So today's episode is all about these topics. We will be discussing what anxiety and depression are, the types of anxiety and depressive disorders, common signs and symptoms, some solutions and treatments available, and finally, when should you seek help? Anxiety is an emotion characterized by feelings of tension, worried thoughts, and physical changes that occur in response to a perceived threat or stressor. This can be a normal reaction to a certain situation, like having an exam or presentation at work, starting a new school, getting married, or moving to a new house. But sometimes this anxiety can become pathological. That is, it can begin to greatly impair daily functioning in different aspects of your life. Anxiety disorders are a group of mental disorders characterized by excessive or constant worry or fear. Some of the most common ones are generalized anxiety disorder, panic disorder, specific phobias, social anxiety disorder, obsessive-compulsive disorder, and post-traumatic stress disorder. Let's take a quick look at each one. First, generalized anxiety disorder, or GAD. People with GAD experience persistent and uncontrollable worry about various topics, ranging from financial issues, work or school performance, family problems, health concerns, or anything else they perceive as a threat. They may also have difficulty controlling their worry, even when there is no apparent reason to be anxious. Next, panic disorder. This involves experiencing sudden and intense panic attacks. A panic attack is a sudden episode of intense fear that typically includes physical symptoms such as increased heart rate, sweating, dizziness, and emotional symptoms such as a sense of impending doom or loss of control. Third, specific phobias. This involves having an intense, irrational fear of a particular object or situation. Examples include the fear of dogs, heights, flying, or enclosed spaces. Fourth, social anxiety disorder. People with this disorder experience an extreme fear of being judged or humiliated in social settings or performing in front of others. Fifth, obsessive-compulsive disorder, or OCD. OCD is characterized by obsessions, which are intrusive, unwanted thoughts, images, or impulses that cause anxiety, and compulsions, which are repetitive behaviors or mental acts that a person feels driven to perform in response to their obsessions. The third, from the bottom, post-traumatic stress disorder, or PTSD. This involves having ongoing emotional and psychological reactions to a traumatic event. Symptoms of PTSD can include flashbacks, nightmares, avoidance of trauma-related stimuli, negative thoughts and feelings, and heightened anxiety or arousal. Depressive disorders are a group of mental disorders characterized by a depressed mood, loss of interest or pleasure in activities, and other symptoms that can affect a person's thoughts, feelings, and behaviors. Some of the most common ones are major depressive disorder, persistent depressive disorder, and seasonal affective disorder. And lastly, another type of depressive disorder is postpartum depression. This happens after giving birth. Major depressive disorder is a mental condition that causes extensive and long-lasting effects on a person's thinking, feelings, and behavior. Symptoms can include a depressed mood, loss of interest or pleasure, fatigue, difficulty concentrating, sleep problems, and suicidal thoughts. Next, persistent depressive disorder, also known as dysthymia. This is similar to major depressive disorder, but the symptoms are milder but longer lasting. Lastly, seasonal affective disorder, SAD, which is a type of depression that comes and goes in a yearly cycle, usually during the winter months when there's less sunlight. Here are some common signs and symptoms of anxiety and depression. You can have either one or more than one of these. Number 1, chronic fatigue or always feeling tired. 2, difficulty concentrating or having a hard time focusing on tasks. 3, sleep disturbances, insomnia, or oversleeping. 4, irritability, becoming easily annoyed or upset. 5, physical symptoms such as aches or muscle tension. 6, negative or suicidal thoughts. If you think you might have any of these, the good news is that there are lots of things you can do to help with anxiety and depression. We suggest trying out the following solutions. A, psychological therapies. There are lots of effective psychotherapy approaches for anxiety and depression. One of the most well-studied and effective therapies for anxiety and depression is cognitive behavioral therapy, or CBT. It is a goal-oriented, short-term type of talk therapy that aims to improve symptoms by identifying and changing negative or unhelpful thought patterns and behaviors that contribute to the problem. Another approach is acceptance and commitment therapy, or ACT. ACT is a behavioral therapy that teaches you to accept rather than fight your emotions, and to commit to acting in accordance with your values. It has been shown to be effective for people who have experienced trauma, those with anxiety or depression, and those living with chronic pain. The third one is interpersonal therapy, or IPT. IPT is particularly useful for treating depression that is linked to problems in your relations. Medication. There are several types of medication that are often prescribed to treat anxiety and depression. Commonly prescribed are antidepressants such as selective serotonin reuptake inhibitors, or SSRIs, serotonin and norepinephrine reuptake inhibitors, or SNRIs, and others. There are also a few types of anti-anxiety medication known as anxiolytics that can help reduce symptoms of anxiety, but these are only meant to be used for a short period of time and should always be taken under medical supervision. C. Lifestyle changes. Aside from seeking professional help, you can try making some lifestyle changes. These include regular physical activity, good sleep hygiene, balanced diet, reduced caffeine and alcohol intake, and practicing relaxation techniques like meditation, deep breathing exercises, or yoga. Lastly, social support. Reach out to a trusted friend or family member, join a support group, or connect with others who share similar experiences. Working with a mental health professional can also be extremely helpful in managing anxiety and depression. And finally, let's tackle the question: when should you seek help? If the symptoms of anxiety or depression last for more than 2 weeks, interfere with your daily life, or cause you and others significant distress, it is important to seek help. It is also crucial to reach out for help if you are experiencing suicidal thoughts or engaging in self-harm behaviors. Remember, reaching out for help is a sign of strength and self-care, not weakness. Taking care of your mental health is just as important as taking care of your physical health. With the right support and treatment, you can manage your anxiety or depression and improve your overall well-being. Did you find this video insightful or educational? Tell us in the comments below. Please like and share it with friends that might find value in this video too. Make sure to subscribe and hit the notification bell for more content. These tips are not a substitute for professional help. They might offer valuable additions to the strategies you're already employing. Thanks so much for watching. Take care and see you soon.